The following segment is sponsored by Northern Nevada Health System.
We're here with Dr. Michael Murray, who is a physician here at Northern Nevada Medical Group to talk about GERD and notably how to avoid it by the foods we eat, right?
Yes. So there's certain trigger foods that can cause reflux. Everyone that has reflux knows what these are for them. Sometimes it's alcohol is a classic, or chocolate. Onions and tomatoes are the kind of the classic things that will set things off. There's also medicines that can cause you to have reflux and things like that. But you want to avoid those things. There's simple things to avoid in your diet so you don't get this burning pain and get that acid up into the esophagus.
Is this somewhere that spicy foods can trigger GERD?
For some people it does. For others it doesn't. It's not always the spice or capsaicin in those peppers that'll cause it. But the classic ones, like I said, are chocolate or coffee, caffeine, alcohol. Those are the classics.
Any kinds of alcohol or across the board?
Across the board, it's just alcohol.
Got it. And then what about the highly processed foods? When you were talking, I was thinking about French fries and hamburgers.
Yeah, that doesn't seem to do it as much as you would think. I don't think that's good for you, the processed food, because you tend to overeat it. And we know that overeating can cause reflux, and that's one of the main reasons why it's at epidemic levels in the country.
And that kind of leads to the next question, which is what kind of dietary changes should we look at to avoid getting GERD or to alleviate the symptoms?
So one of the main things we see is that the cause of reflux and these hiatal hernias and weakening of that area is from overeating and stretching out the valve. And so everything in the United States has become supersized. Everything's very large. We used to have quarter pounders and think that was a lot. Now everything's a half pound hamburger. So it's just something that you ought to think about. The Japanese have a saying where eat till you're 80% full, and that's when you should stop. And we know that overfilling the stomach, if you're prone to reflux, is going to make it worse.
So we Americans sometimes eat till we're 180.
About right.
Full.
Yes, that's exactly right.
Okay, doctor, thank you. Appreciate that.
Thank you.
For more information, go to our website, mynews4.com.